Over 15 medical doctors from across Karamoja region have undergone a 3-day pediatric surgery emergency course that took place between 7th and 10th of March at Moroto Regional Referral Hospital. The training, which was organized by the referral hospital, was meant to build capacity of the medics and also boost their working relationship with experts for further guidance.
So we thought that if we collectively come together as both as specialists and also young doctors who are scattered all around the region in Karamoja, working for both district and health center force, and we train them, first of all, to identify these conditions, and then to give appropriate initial treatment. Then the other thing is that the simple ones, they may not necessarily need to refer, they can work on them from where they are. The other thing was that that through the training that we can create a community where we continue to interact with each other and they can actually consult us from where they are.
Within Karamoja, of the 9 districts, that is Moroto, Abil, Kotido, Kabong, Karenga. Each of those was represented by a medical officer. So in the training, it was really good. This was all about pediatric emergencies.
According to Dr. Gideon, there is a growing number of children-related surgeries that were not supposed to reach the regional referral hospital, but because experts in various health center force, district hospitals and general hospitals had no capacity to carry out such, it has flooded the hospital.
We're losing a lot of young children because of a number of factors, including late referrals, meaning that the doctors who would have seen them initially would, for one reason or another, delay to refer them to us, and they would refer them without having done the necessary treatments that would make sure that they will reach us when they are in a status where we can help them, especially young children. They don't have really a big spectrum in which they can operate. They do not cope with the diseases so easily. So they have a narrow window in which you have to work on them. And so they would come to us when it is too late, and then we would lose them, and then of course cause a lot of frustration.
Dr. Phyllis Kiza, the pediatric surgeon at Mulago Hospital, who facilitated the training, said the course was designed to give the medical doctors confidence to carry out operations on children, which most do fear due to its difficulty.
This is a course because many times we have children who are mismanaged, or they are transported in ways that might cause further injury to them, or they may not get the appropriate resuscitation. Many doctors are used to dealing with older patients, but they fear children. So this course is designed to give people more confidence in managing children who have surgical problems, but also it helps them to know that there's a network of people who care about them and the patients that they look after, so they know that there's a network that they can consult to help them manage the patient.
She added that due to the complexity in accessing healthcare services in the region, with most health facilities located in remote areas, the head of surgical department of the referral hospital reached out to her for a special course to remote medics so they can be able to handle emergency cases.
And we know this is a very difficult to reach area, and with a very wide geographical span for the area. But also about 18 months ago, we were planning to do this course in Bale, and just before the course I met the consultant surgeon who is the head of the surgical unit here in Moroto Hospital, Dr. Gideon Rukundo, and we're speaking about these things, and he actually expressed that they're having a high mortality of children. The referrals they're getting are very late, but also some of the doctors they have in the more remote health centers, they struggle a lot in making decisions, and sometimes they refer patients who refuse to go, and I mean they have a right to refuse that.
However, Dr. Michael Teko, one of the medics in Moroto Regional Referral Hospital, suggested that the training was very short and yet the concerns are really common, but very few experts in the region.
The time frame they had given us to train and learn and put things in practice was short, just like 3 days. It's not easy in 3 days to get everything right, though we tried. So in such, we really need more time for this to be done well. At least if they could train us per quarter, at least once in a quarter, and I'm sure the other medical officers of other districts can also be able to identify and do the correct procedures, emergency procedures before referral patients. And though in some of the districts we have no anesthetic officers. You know, you cannot do any operation without anesthetic officers. But in terms of the sickness, there are very many cases in Karamoja, and most of those die in the village because there's nothing we can do. They stay in the village. They have complications. They cannot come to the hospital. The hospital is very far. Even if you mobilize, still they'll need a transport to reach the hospital.
He called for better equipment of the children's theatre so that lives can be saved.
There's really need for Karamoja to have such. At least maybe regional referral, Matani hospital, maybe 2 hospitals in Karamoja to have well-equipped anesthetic officers, the medical officers, and all what it takes for the surgery to take place.
According to the Moroto Regional Referral Hospital Director, Dr. Stephen Pandey, the aim of this capacity building is to enhance service delivery in the region, reduce referral cases, including self-referral, and also decongest the hospital by equipping medics in remote health facilities.
The aim of this training is to keep the healthcare workers within this region, first of all, to identify. They should be able to identify these cases and do what they can at that level. If they can't do, then refer to Moroto Regional Referral where they can be attended to. Yes. So at the end of the day, we are going to equip health center force, general hospitals within the region to be able to attend to these cases, to attend to them, and also at the same time be able to refer those ones that they cannot be able to refer. What we want is to see that the cases which are coming here are actually referred cases, not self-referral, whereby because of failure to access services wherever, maybe in Abiratok or Amodato, so they end up referring themselves to the regional referral store. And at the end of the day, we also want to see that the regional referral store can be decongested. We can have less of those minor cases coming to Moroto Regional Referral Store, and they can be, because they can be attended to at the Health Center 2s, Health Center 3s, Health Center 4, and the General Hospital, and also other facilities within even the VHTs can attend some of these people.
He added that with the training done, cases of death arising from complications, early detections of the diseases shall be realized, and as such, only specialized cases can be handled at Moroto Regional Referral Hospital.
And at the end of the day, we are going to see that we reduce on the death arising from those cases. We reduce on the burden of disease arising from those cases, because they are and also complications, because they are able to be detected early enough and attended to early enough. And at the population level, we are going to see people who are healthy in the community, people who are productive, people who are able to fight disease and all that, and also to be able to support government's intergovernmental drive towards the Vision 2040.
Recently, the Permanent Secretary at the Ministry of Health, Dr. Diana Twiney, launched the Pediatric Surgical Service Plan in collaboration with the Kids Operating Room Organization UK, with the vision that no child should die or live a life of disability or pain because of a surgical treatable condition.